Patient, activating your health power. Nurse T, I know she got to get these grooves in. That was fantastic. That's why we open the door so y'all can come on in and get your grooves in. All right, Nurse T, come preach for us. I'm gonna give y'all the cue. Yeah.
All right. Y'all ready? Y'all ready to be healthy? Y'all ready to activate your healthcare power? You ready to start that healthcare with you? So we've been in here jamming all day, right? We didn't had a whole lot of information. The community then came out to celebrate Martin Luther King Day, and it's all about us being healthy. Can I have some people in the room say it's all about being healthy? Because see, health don't start with the physician. Health start with you being familiar with what's going on. My topic today is to talk about breast cancer, which is the second leading cause for women in America. But you know why? It's because sometimes we're scared to go to the doctor. How many people scared to go to the doctor because they don't want the doctor to give them some bad news? But guess what? It's not about receiving bad news. It's about receiving news that's going to help you with early detection so that you can put a process in place so that you can be healed. We got a lived experienced breast cancer survivor in the room right now because it's all about early detection. Can I have somebody in the room say early detection? Early detection is all about prevention. So I can stay to the script or I can be radical. Which y'all want? Y'all want me to be radical? All right, so do y'all remember James Brown? When James Brown used to say, I'm going to have a funky good time. But I'm going to change the lyrics up a little bit. Instead of us having a funky good time, we going to have a healthy good time because it's all about your health. It's all about you being empowered. It's all about you knowing the information and having the resources for you to make sound decisions because guess what? I'm tired of African American people coming to the hospital and they don't know what's going on because guess what? Diseases are preventable, but it's only preventable if you put in the action to take care of yourself. So I need a room full of people that's ready to shout, activate your healthcare power. Are you ready to activate your healthcare power? Are you ready to have a healthy good time? Come on, Bear. Come on, y'all. Get up on your feet and let's celebrate. Because guess what? We're about to have a healthy, good time. Because see, it's all about knowing those risk factors, those signs and symptoms. Are you ready to have a healthy, good time? If you're ready to have a healthy, good time, I need you to get up on your feet and say, we're about to have a healthy, good time. We're about to have a healthy, good time. We're about to have a healthy, good time. We're not going to be afraid to go to the physician because when we go to the physician, we're going to be able to tell the physician that we had our breast examination and that there's further studies and we might need an MRI because guess what? A lot of times we don't go to the doctor because we're afraid of the results. But guess what? I declare right now today that we are speaking out of our mouths that we are going to have a healthy good time because guess what? Self-care is the best health care. So I need the community of Flint to let the people know we are about to have, come on now, a healthy good time. See, some people might have came out to play, but when I come out, I don't come out to play. I come out to educate the community so that the community can be informed. Because guess what? When you know better, you do better. And guess what? You're about to have a healthy, good time. Because when you know better and you research the information, guess what you do? You understand. So when you go to your doctor, you might be a little nervous. I'm saying you might be diagnosed with breast cancer, but guess what, sister? You ain't got to panic, because guess what the panic would do? The panic will procrastinate your purpose, and you won't reach your healing process. All right. Y'all wasn't ready for this, huh? It's because, see, I'm radical, and I'm uncut. And guess what? We're going to start being a community, right, that's not afraid to go to the doctor. But you say, but Nurse T, sometimes when we go to the doctor, right, they stereotype us. When we go to some hospitals, they stereotype us, and they make us feel uncomfortable. But how many of you know it's not about how they make us feel? It's about what we need. So sometimes we have to just hear what they say and say, yeah, but these are the issues that I'm having. You guys motivated now? Do I got the attention of the room? All right. So one good thing is to know the facts. Breast cancer is a disease in which malignant cancer cells form in the tissue of the breast. Guess what? Males can have breast cancer as well. The second most common type of cancer in American women. And I know sometimes we be devastated because you know what? Because it's our breast. And how many women don't feel some type of way when something is impacting their breast? You know, who wants to go to the doctor and hear that you may have to surgically remove your breast? That can be devastating to us. Regular breast checkups are the best ways to detect breast cancer early. It's a lot of information out there on the tables. It's a lot of community resources. But the thing that I want you guys to remember, if you don't ever remember nothing else that Nurse T said, early detection. Why? Because if you wait, it just might be too late. When it comes to breast cancer, there's no barriers. When it comes to gender, ethnicity, race, anyone could potentially develop it, particularly if they have risk factors such as prior oral contraceptives or hormone use, genetic factors, and family history. A lot of us from young ages, if we keep it real, have used birth control because we didn't want to get pregnant. Scientists and researchers have made great strides in the treatment of breast cancer. Being vigilant and watching for the early signs of breast cancer is the most effective steps in successful treatment. It is important to pay attention to your breasts. Ladies, it's important to pay attention to your breasts. And men, if you have a woman, it's important to pay attention to her breasts. Because if you notice any changes or anything that's abnormal, you might be the first one to notice it. We grown in here. So men, while you are looking at your lady's breasts, you know, learn how to do some breast exams so you can help her discover if she have cancer early. You know, it has been situations that has happened. Now, don't act like y'all shy in here now. I see you, It can be size or shape due to swelling or other factors. Some women notice pain or a red, irritated rash in a certain area that doesn't go away, and lumps may be felt or even be visible in the breast or under the arm area. As I said, when we was jamming to the music, don't panic, ladies. Because when we panic, what we do? We call about 5, 10, 6, 7, 8, 9, 10 people, and we be like, you ain't gonna believe what happened. I got this, I got that. And guess what? We never put into work to actually see what we have. If by chances you are diagnosed with breast cancer, know that doctors and pathologists will examine biopsy and do imaging results to determine the stage. It's good to know more than 200,000 cases per year treatable by a medical professional requires a medical diagnosis. Lab tests or imaging required. Treatment may consist of chemotherapy, radiation, and surgery. Self-care includes regular breast exams. Schedule your mammogram. Don't do like me. Have it scheduled and then don't go. Then I thought, well, how could I be out here educating in the community and I don't go? You know, that's how fibroids slipped up on me, because I kept scheduling my yearly exam, but then I never had time to go. And then one day, you know, the assistant nurse manager was like, you going today? And guess what? I had fibroids. That was the size of a grapefruit. But guess what? I probably could have caught it before it got to that point. So I'm not just up here talking because I've been a nurse for 22 years. I'm up here talking from lived experiences and also caring for my community at a level 1 trauma. Do you know how devastating it is to have patients come in and say, had I known, well, guess what? Now today, you do. And you know what? And sometimes the message is not always for you. It's for your loved ones. It's for your family. Because we got to do better. Screening guidelines for early detection in women who have no symptoms start at age 40. So that means at age 40, every year you have to have a mammogram. Now, they do hurt a little bit because, you know, they put you in there, then they squeeze your breast and all of that. But guess what? That little bit of pain can save you from having to go through chemotherapy, losing your hair, having a surgical incision. And for those that have survived breast cancer, you know what? Just know it's not all physical, but as well mental and emotional. So if we do know anybody that's going through breast cancer, let's love on them and support them so that they can have better health care outcomes. So we're going to end up with a little quiz. Y'all didn't know y'all was going to take a quiz? Y'all ready? It's going don't be running away, Denise. I see you. So it's just true or false. So when I say the question, y'all shout true or false. It's very simple. Breast cancer is a disease in which malignant cancer cells form in the tissue of the breast. True. All right. Breast cancer has barriers and usually only develops in certain genders and race. Early detection starts with your neighbor. Breast cancer is the second most common type of cancer in American women. Regular breast checkups are the best ways to detect breast cancer early. Change in breast size or shape due to swelling should be ignored. Symptoms mean you always have breast cancer. A mammogram is used to detect and diagnose breast disease. Self-care includes regular self-breast exams and scheduling mammograms. Recommend for annual mammograms to start at age 50. What's the answer? Y'all smart. So with all of that, I would like to say thank you very much. Did you guys learn something? Well, all right, because we didn't have a funky good time. You know, I had to renew the lyrics, you know. So we're gonna have to get together and patent that song because I can't sing it without y'all no more. Music does help, yeah. So I'm done. So should we continue with the healthy good time? Well, you know what? She's not here, so we might as well come on. Here, let me give it to you. Huh? Oh, well, you know what? Some of the guys stepped out, so break time. But I appreciate you guys, and once again, I am Tarnesa Martin, patient resource and community advocate for Hurley Medical Center. My job is to serve as a community liaison for identified health concerns to help you have better health care concerns. Hurley has 3 tables out there. My information is on the table. If you need to contact me for healthy information, please let me know. God bless you.